if I traded it all, if I
Welcome back, everyone. And I have another newbie with me. I have with me Dr. Farahani, and he is the owner of Foot and Ankle Institute of Arizona. Welcome to the show, Doctor. I also am live on Facebook, so I want to say hi to everybody.
Hello.
Like us and follow us, and we'll share the show. Bring that right up into your face, and tell everybody a little bit about yourself and what you do.
First off, Carol, thank you so much for having me on your show.
Thank you.
It's a pleasure. My name is Dr. Farahani. I'm a CEO and medical director for Foot and Ankle Institute of Arizona. I'm pretty much handle any foot and ankle ailments, consisting of bunions, hammer toes, flat foot, all the way to diabetic foot evaluation and peripheral neuropathy, etc., etc. So,
well, no one knows this about me, and I'm going to say it right here live on the radio with you. I had hammer toes when I was younger. I mean, this is like 30 years ago,
it's
at least.
Probably
maybe
all those good shoes you used to wear.
It was those really tight shoes, but I had to have them fixed because I had spurs and I had all sorts of things. So let me just say something. Today you said that you wanted to come here and talk something very important. Let's talk a little bit about that.
So, I feel like most of my patients who come to my office, we don't get to educate the public. We don't get to educate patients. And many of my patients who come in, they're probably part of the geriatric population, which they probably have, diabetes and then, other nerve damage issues and so forth and so on. So I wanted to discuss blood sugar today and kind of just do a little bit bold that stuff so that listeners can actually understand what it is and so forth and so on.
And we do have a little bit of an older clientele that listen to us. And here's what, again, I love about this show. It's just information, and this is a great way for you to educate the public. Now,
Absolutely.
You're located at 40th Street and Union Hills. You do free consultations.
Absolutely, yes.
You're rated with the Better Business Bureau. And today, what we're going to do is, if it's okay with you, you're going to talk a little bit about a session that you offer, which is a laser therapy. And we're going to talk about that, and we're going to be able to give it away. You want to check out his website. It is footdocaz.com. Okay, let's talk about what blood sugar is.
So let's put it out there. I treat a lot of patients, and one of the advantages that I've had in my practice and the successes I've had is that I treat everybody like family. Anybody who comes to my office, they're treated like family from start to finish, and anything that happens to them or anything that I do for them, it's based out of love, and it's nothing different that I wouldn't do for my own family members. So we're talking about blood sugar. Blood sugar is just whatever we eat through our mouth, goes in through our digestive tract, and it gets stored as something what we call glucose. And glucose is pretty much comes from a lot of food that we eat, carbohydrates, rice, bread, etc., etc. And what happens is that part of the organ in our body, which is called pancreas, it has insulin, and insulin kind of regulates these blood sugar levels. Hence why you probably have heard type 1 diabetics and you've heard type 2 diabetics. Type 1 diabetics, their body does not make insulin, and then type 2 diabetics, which most of the geriatric population that we see about, they're pretty much type 2 diabetic, and they either don't produce insulin, or there is insulin, but it's actually not coming in to grab those extra glucose that's been sitting in our body, and so we get an extra burst of those glucose, and now the body cannot take that in as a source of energy, and it kind of sits in our body, and that's why a lot of patients end up being diagnosed with hyperglycemia or becoming diabetic and so forth and so on. So one of the things that I always tell my patients is that you can eat. What we eat is a big thing. What we put in our body, it ends up making a big difference in what happens in our daily living. And part of that is, I always joke around and say, if you eat a brownie versus a banana, yes, they're both sugary, and my wife always jokes around that, oh, you're eating a brownie, but in reality, brownie and banana are both sugary. But what happens is that brownie has all sugar, but banana has potassium and some vitamins that your body can actually use as it needs, but brownies just don't have those benefits. So it's very, very important to take in and be cautious of what we actually take into our body.
Well, the problem is we don't. And we've been doing it for years.
I mean, I'm guilty of it, and I'm sure everybody else is guilty of it.
Everybody is. And here's the thing, though. What happens is they're going on and on and on, and they're eating bad, and then they have, neuropathy, which we talked a little bit about. And would you please tell everybody what happens when somebody has a high, and they start to get neuropathy?
So here's what I always tell my patients that come to my office. Consider your right hand and consider your left hand. The right hand is the blood sugar. Whatever you take in, if it's sugary, if it's carbohydrates, if it's anything that's sweet, the right hand will go up, and that's your blood sugar, the content of the sugar inside your blood. The left hand is the sensation to the bottom of your feet, and what happens is that sometimes when these sugars spike up, the body and the nerves love sugar, and what happens is actually diabetes can cause direct damage to your nerves, and this is otherwise known as peripheral neuropathy. You probably have heard it from your primary care physicians to vascular surgeons and so forth and so on. So peripheral neuropathy is just the damage that's been caused by directly from diabetes and so forth and so on. And a lot of people, the American Diabetic Association actually has said that 60 to 70 of the people with diabetes will develop neuropathy within their lifetime. So it is very, very important. Now, not to mention that it's not just diabetes that causes neuropathy. There's other factors. Sometimes people, unfortunately, who go through cancer and they have to get chemotherapy drugs and stuff like that. A lot of, unfortunately, we talked about in your show about alcoholism, and alcoholic neuropathy. Some people just mainly had motor vehicle accidents, have lower back injuries, and that leads to eventually to have sciatic problems and also direct effect as far as peripheral neuropathy. So.
Now, I want to get out our special, so can you tell them really quickly, I know we're going to talk about it deeper, but what the laser therapy that you do is?
Okay, so peripheral neuropathy is a symptom. It's a cause, a direct cause by what happens when you have diabetes and you don't control it, by meaning eating healthier, taking medications, seeing your primary care physicians on a frequent basis, doing that HbA1c, the percentage, to keep it at a certain level and so forth and so on. What happens is that when you have peripheral neuropathy, you start developing burning, tingling, numbing, and shooting and stabbing sensation in the tip of your toes or fingertips. And so those sensations are direct symptoms of peripheral neuropathy, and they are abnormal sensations. And these are, if you feel that you have diabetes and you feel that it's not controlled and you develop these symptoms, then it's probably a good idea to seek help from either your primary care physician or see a podiatrist. But talking about low level laser therapy, there's many drugs out there that control the symptoms of these burning, tingling, numbing sensation of peripheral neuropathy. However, the biggest problem is that these drugs have side effects directly affecting your liver. Well, a few years back, they came out with this low-level light therapy that actually helps you with the management of the symptoms of neuropathy, but yet doesn't have those main side effects that we talked about.
Well, we're going to talk about it deeper, but I want to give it out because I'm going to open up the lines to the audience.
Yes.
Because this is what you're doing. You're offering a free session to everyone to get entered into WIN. It's a laser therapy for the management of neuropathy. It's a $250 value, free to you or anyone you know. Anyone that's listening to this, if you know somebody, enter them into WIN. The number to call here is 602-277-5369. We're also going to give people who don't have neuropathy, we're going to enter them into WIN a pair of orthotics. Everyone loves orthotics. So you can call in here at 602-277-5369. Toll free, it's 1-866-536-1100. Check him out on his website. It's FootDoc, footdockaz.com. You can also call them direct. They do free consultations. They're rated with the Better Business Bureau at 480-788-2524. Call in here, get entered in to win a laser therapy or a pair of orthotics. The number here is 602-277-5369. We have less than a minute. So for right now, what would you want to leave them with before the break?
What I want to leave them with is that if you feel that you have diabetes and it's not controlled, you got to get with your primary care physician to get that controlled, and also demand your primary care physician to send you to a foot and ankle specialist or a podiatrist to do a foot evaluation on you.
There's things that you can do, and when you say that the medications that they're on could cause even more trouble, this is not what you want. Again, I know that there are people out there that are listening that are sufferers. You don't have to suffer. You could call in here, get entered in to win, or a pair of orthotics. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. Hang tight. We'll be back in just a minute.
For trading it all.
Welcome back, everyone. We are talking with Dr. Farahani, and he is the owner of Foot and Ankle Institute of Arizona. They're located at 40th Street and Union Hills. They do free consultations. They're rated with the Better Business Bureau. The website is footdockaz.com. And what we are doing here is we've got our lines open here for everybody to get entered in to win. This is one free laser therapy that's a management for your neuropathy if anybody is dealing with it. And a lot of people do. We're going to talk more about that. That's a $250 value free to you or anyone you know. If you're taking medication, you may not have to. You shouldn't be, because he said it could actually be doing you harm. Also, for anyone that doesn't have neuropathy or anything like that, we're also going to give away a pair of orthotics for everybody out there. So you get entered in to win. Our number here, 602-277-5369, and toll free, it's 1-866-536-1100. Just keep on calling everybody so you guys can get entered in to win. So we were talking a little bit about the laser therapy. I think you might want to go a little bit deeper on that.
Sure. So what I was telling the listeners and yourself is that there is multiple avenues to manage these symptoms. Most people don't understand. When you have peripheral neuropathy, you can never really get rid of neuropathy. What happens is that, yes, remember I told you about the right hand versus the left hand. The right hand was the blood sugar. Goes up after you eat, you take medication, you go walk for 20 minutes, or you watch what you eat and so forth and so on. You see your primary care physician on a day in and day out, or every 3 months or so, and that is reversible, goes up and comes down. The problem is when we talked about the nerve endings loving sugar or the glucose, is that the diabetes and the spikes in the blood sugar can directly damage the nerves now. So now when the nerves are damaged on your left hand, which we talked about, is that now you're starting to lose sensation to the bottom of your feet. So what happens is that, God forbid, in these Arizona hot summers, you walk on gravel without wearing a proper shoe gear, like either wearing something. And now you don't have sensation like you and I would, who don't have diabetes. And then what happens, now you open yourself to a can of worms. You start getting sores, you start getting ulcerations, wounds, and so forth and so on, that could lead to potentially other risk factors and so forth and so on. Knowing the symptoms is very important. Knowing what your numbers are, for instance, what your blood sugars are and what your HbA1c is. And then after that, then we can do different things to manage these symptoms.
Doc, I have a question to ask you.
Yes, ma'am.
Because a lot of people out there procrastinate. We know about that, right?
Sure, yeah.
But they don't even know that they don't check their levels, and they don't even know that they realize that they are getting to the point where they have diabetes. That, when they walk on their feet, and it's a sensation of needles, right? Isn't that is that one of the signs? What are some of the signs?
So some of the signs is that the first sign is that you feel like your feet are so hot, like literally like it's burning. And then sometimes when you're sleeping, you feel like it's burning, tingling. you feel like it's asleep, all these, or sharp shooting pain to your toes and stuff like that. Those are all the symptoms that you're looking for. So now you put 2 plus 2 together. Now you have these symptoms, and then maybe you have diabetes. That probably is a good indication that you probably should start seeing your primary care physician. They'll do a simple blood test on you. They'll figure out what your blood glucose. Remember, having diabetes is not an issue. Having diabetes can be managed early on. The problem is with those folks that we're talking about is that not knowing what they have, and then it leads you to other problems in the future.
Sure. Now, when people that are listening, can they call you direct, or do they have to have a recommendation?
So there is multiple avenues. There is insurances. It's a different topic. Maybe someday you and I can talk about those for better education of the public. But for the most part, I take all insurance plans. So some insurances require a referral directly from their primary care physician that it could be very reasonably obtained, or sometimes have people who have direct PPO plans and Medicare and so forth.
Depends.
They can call the office. I have 2 lovely ladies that work in my office. They can guide you guys, and like I said, remember, I treat everybody like family. We treat everybody like family. So when you call, you will get that feeling that you're actually calling your own siblings or daughter or son versus calling a doctor's office.
Now, their phone number is 480-788-2524. They're rated with the Better Business Bureau. They do free consultations. You can check them out on their website. It's footdocaz.com. And you can also call in here because we've got everyone getting entered in to win 1 free laser therapy for anybody that needs the management of neuropathy. That is a $250 value, free to you or anyone you know. Also, we're going to give away somebody a pair of orthotics. So our number here is 602-277-5369, and toll free it's 1-866-536-1100. I want to go a little bit because, we only have a few more minutes. And if it's okay with you, I want to also talk about just feet problems,
Sure.
Because you don't just, you'll
Absolutely.
do anything. Right?
Absolutely.
So what is the number one thing that you see?
The number one thing that comes to my office is actually bunions, and it's
and a lot of people have them.
Unfortunately,
a lot of us old folks have them, you guys.
Unfortunately, or fortunately, comes from a lot of them are female patients because they wear these ill-fitting shoes, high heels, and a lot of us think that in our younger years that what we do or what we wear doesn't cause any issues.
No, we just don't care.
Well, or you don't care, but they really do. So bunions, hammer toes, flat foot, and so forth and so on, which you talked about. Orthotics, it's a perfect thing to use if you have flat feet or you have have bunion deformity, which we can slow the progression of certain pathomechanics of the foot to prevent it from happening, so forth and so on. So
What else is things that you can help with?
Anything, wounds, sores, tendinitis.
Ingrown toenails?
Absolutely. Ingrown toenails happens a lot to my younger generation. I have patients, 8-year-olds to 99-year-olds who have ingrown toenails. Causes the nail to go directly into the flesh and so forth.
How about nail fungus? Can you help with that?
Absolutely. Fungus, like I said, it's one of the other things that there's medications out there. Unfortunately, medication causes liver burnouts and so forth and so on. So a lot of people can't take medications. There's also laser therapy that you could use for treatment of fungal nails and so forth and so on. So there's a whole variety of things. Unfortunately, since this is the first time I'm a guest in your show, our time is limited, but hopefully in the future we can discuss different topics and so forth and so on.
That's why I wanted to just get a little bit of that out. So again, you could call in here. You can get entered in to win the free laser therapy that's for managing neuropathy. It's a $250 value, free to you, or the pair of orthotics. So either one, 602-277-5369, and toll free it's 1-866-536-1100. Back to this. What else would you want to talk about with the neuropathy?
Well, we're going to talk about laser therapy real quick.
Go for it.
We talked about medication, management of symptoms, including burning, tingling, numbing sensation. When you have those symptoms, potentially your primary care physician or doctor puts you on a medication. Often it's called gabapentin. The problem is these medications bring down the threshold of the pain caused by neuropathy, but however, they cause and they have side effects, direct side effects such as causing extra increase in the markers that are seen in your liver. So a lot of patients nowadays come to my office, ask for alternatives to medication, which is also called conservative therapy. It's low-level laser therapy, which increases oxygenation. It increases the stabilization of the cell metabolism, increases the cellular nutrient level, and in direct effects reduces the pain threshold caused by peripheral neuropathy. So that's pretty much it.
So how effective is the laser therapy?
You know, honestly, I never ever go based on what companies that come and sell you these laser machines, because, you know, somebody paid for them. So I always try to do research on my own patients. So what I have found that in every patient, on the 500 patients that I have actually been fortunate enough to manage their symptoms, I've had a 92% relief rate. Relief rate meaning that I have been able to reduce their pain, burning, tingling, numbing sensation. When they walked into my office, they were at 10. They couldn't barely sleep at night, and it kept them awake all the time. But now, after several sessions of laser, they are at a 1 or 2.
And we're not talking about medication here.
Absolutely, and you don't need to worry about burnouts in the liver, etc., all the side effects.
So they're located right at 40th Street and Union Hills. They do free consultations. They're rated with the Better Business Bureau. You could check them out on their website, which is footdocaz.com. You can call them direct. Their phone number is 480-788-2524. And whether it's you or someone that you know, get entered in a win on this free session. It's a laser therapy for management of neuropathy. You don't have to suffer. You do not have to be taking medication, and you shouldn't be. It could be harmful to you. It's a $250 value free to you or anyone you know. Also, we're going to do a pair of orthotics. Everyone's getting entered in to win that. Our number here again, 602-277-5369. Toll free, it's 1-866-536-1100. Check it out and get entered in to win. Look at their website. You know, guys, there's a lot of people that suffer, and when your feet hurt, let me tell you, your whole body hurts.
Absolutely.
And there's no reason for it. And a lot of people suffer from their diabetic neuropathy, and you don't have to. Doc has been doing this how long? You said you've done 500 patients and have a 92% success rate. Check him out on his website. It is footdocaz.com, or call in here, get entered in to win. Our number here, 602-277-5369.